All right, everyone. This is Dr. Jason Hahn with HealthFit Physical Therapy and Chiropractic. I am joined by Dr. Giancarlo Licata. It's a pleasure to have you.
Thank you.
You've been amazing. You've introduced me to the Pasadena interprofessional community, put me in touch with so many disciplines that I didn't even know existed. And
Right.
I'm eternally grateful to you and everything that you've done. Dr. Licata is the owner of Vital Head and Spine in Pasadena. He's an amazing chiropractor, but I'll let you talk a little bit about yourself and just to introduce yourself to everyone watching.
Cool, Jason. Yeah, thanks. I'm the founder of Vital Head and Spine here in Pasadena, and we're a brain health practice, and so we basically provide care for chronic pain, focus and attention challenges, and concussions. I mean, those are kind of our big three. And we have two sides. We have what we call NUCA, specialized chiropractic, and we also have brain mapping and brain training, which is QEEGs. We map your brain, and then and neurofeedback, very very high level neurofeedback, so that we can really make huge changes in people's brains. So yeah, it's fun. Thank you. So I've been doing this for about 12 years now. And I also co-founded the Pasadena Interprofessional Community, which is a group of over 100 different health professionals. And we get together and we learn about what each other does and how we can collaborate on complex cases. Because frankly, a lot of people need more than one person on their team. So,
right.
Yeah.
I think one big thing you've taught me and everyone in the community is that we can't do it by ourselves.
Yeah.
And, being collaborative and is the only way to get the best care for our patients. And introducing all the amazing stuff that you're doing from a brain training side. Like, I didn't even know what that was before I met you.
Yeah.
And I go to your office, or I first see one of the lectures that you brought in, one of the amazing speakers. I'm like, okay, this is interesting.
Mm-hmm.
And I found out that you do it. I go into your office, you show me all this amazing technology that looks like I get to play a video game.
Right. Yeah.
And I'm like, okay, what is this stuff? Can you talk a little bit more about that brain training side?
Yeah. So about 3 years ago now, we were really seeing a lot of concussion cases, and so we were addressing it from a head and neck trauma standpoint. So we were part of concussion teams where we would address the neck issues, the headache issues, and the vestibular, the dizziness issues, right? And then other people on our team would be the physical therapists like yourself, other kind of, eye ocular motor therapists and cognitive training therapists and neuropsychologists. So we were kind of always partnering with these ad hoc teams around these different athletes or even a lot of adults. And then, but then after a while, I was realizing that there was no real objective way to kind of see what's the brain doing. Like, we were all just kind of clinically using our skill set to kind of determine what people had based on how they were functioning on the outside, So it really got me interested in some imaging, and so that led me to looking at brain mapping, which is basically looking at the electrical output of the brain. And what I found was that you can actually tell a lot about the function of a brain by measuring the electricity of it. And so we partnered with a company that was doing it here in office, and we started just really exclusively working with concussion cases. And what we found was that, one, we could see regions of the brain that were either overactive or underactive. Two, we could have them use certain technology where they would sit. We would hook up little sensors to the scalp. We could see their brain waves real time, on the screen, and then we can run that through a video game. And what we discovered was that after a series of training sessions, we could literally set parameters where if a region of their brain was overactive because it got traumatized, the neurons were overfiring, causing more inflammation, but also that inflammation was disturbing and creating maybe a lot of brain fog. We can train those regions down so that every time they were playing a video game, every time their brain waves went down in a certain frequency, if they were flying a fighter pilot jet, what you'd see is all of a sudden the jet starts going more towards target every time their brain waves started cooperating.
Wow.
And so anyways, we started getting into that, and we were seeing phenomenal results. I mean, it was just a really profound change for people that were having concussions. And we were able to access it in a way that nothing else could. So it doesn't take the place of everybody else, right? Like, we still have the physical therapists doing what they're doing. We still have others doing what they're doing. But it really allowed us to just kind of non-invasively image, kind of really pinpoint, and then train in a pinpoint way. So after that, we've been using that for all kinds of things.
Yeah, it's kind of amazing. We recently we spoke about concussions. I'm the head therapist for the LA Football Club, so we get our share of concussions and that kind of stuff. So like in the general physical therapy rehab world, it's you make sure they don't have symptoms with simple tasks to start. Then you move them on to the next activity, which might be a bike. Or so once they clear that, it's a lower intensity kind of activity. Then we might get them to lift. Then we might get them to run, which is some type of impact, and then more sports specific activities, and just hoping they don't have symptoms that arise. And then usually, we usually start with an impact test, which is more objective. It's a computer-based test. It looks at reaction and more subjective kind of things. But through the process of rehab, we're just getting subjective answers. And if a player really, really wants to play, they can just say, oh, I don't have dizziness. Oh, I don't have brain fog. Oh, I don't feel nauseous. I feel great. So, something super objective like what you do is imperative in making this process that much better.
Yeah, it really helps. It really gives any clinician, and what we'll often do is we'll kind of use the map as kind of a central hub of one of the other objective tests that everybody's using. And then with the team, and I say this like an ad hoc team, like my practice, your practice, another practice down the road, a practice over in Beverly Hills, we become an ad hoc team, right? Like all of a sudden we got to work around this one person. And oftentimes that map ends up being really useful for you, right? It'll be useful for the a vestibular therapist. It'll be useful for the ocular motor therapist. So it's really great to be able to have some objective data. And again, I think no one test tells you the whole picture. No one test gives you the whole thing. But what I like about what we call brain maps, about EEGs, is that if you categorized brain imaging into two categories, you could basically break them up into structural imaging and functional imaging. Right. Okay. And so structural imaging would be things like MRIs and CT scans. And then functional imaging would be like an EEG or a functional MRI or a SPECT scan, right? And so now they're all looking at different things, but essentially, I think most of us have heard about MRIs or CT scans. Right. But I'll use the example of a laptop computer. I could say, look, if you tell me your computer's not working, and I look at the outside and the structure of the computer, and I say, look, there's no dents on the computer. There's no, all the keys are on the keyboard. You're probably fine. Like the computer it has no injury. And that would be like an MRI or a CT scan of your brain. Right. And so, a guy gets a concussion, and the first thing that people want to do is go do an MRI. And oftentimes, 9 times out of 10, almost 10 times out of 10 for most of us, that's coming out negative. Yeah. Right. So now the challenge though is that person doing okay? Right? Like the person isn't feeling well, something's going on. So an EEG allows us to look at the function. And so that's like looking at the laptop again and saying, well, let's look at the software. What's happening? How's it running? What's the running speed? What's the running time? What happens when I open up the internet? What happens if I open up a word processing program? Like I can start to now functionally start to test it, Right. And so we can see at rest, both with eyes open and eyes closed, what the different wavelengths are of the brain. And we know that we can compare that to kind of a normative database. And so we can start to see, wow, all of a sudden, you've got incredibly large amounts of what we would call high beta, very fast brain waves that are very typical when you have some shearing effect, some shearing from a concussion.
Huh.
And so, and so we can see, look, there's still a lot of injury in here. There's still a lot of inflammation probably in here. You may not want to go and do a bunch of header training, right? You may want to kind of stay away from some of that. Like again, if you're a soccer player or a football player. So that's really useful. Yeah, it's an objective test that's a functional test. Right. And it allows us to catch things that may not show up in an MRI or a CT,
Yeah, we've definitely we share a number of patients that they just talk wonders about the brain training stuff. I've been having these symptoms for months or even years, and then that's what changed it.
Yeah.
And I'm like, wow, this thing's pretty powerful.
Yeah, and again, yeah, absolutely. I mean, it's what I love. And again, I never want to take away from all of the other things. We have to be part of people of this team. But, we had another, he played very, very, he played pro soccer in Europe, and he flew from the UK to come see us. And he had significant TBIs. And so he ended up staying here for 5 weeks, and we did the brain training here. And what we found was just phenomenal changes. I mean, even involving, speech, and involving, and this was, these were concussions that had happened not just recently, but, these were things that had happened, years prior, right? And so, we were able to do, identify, to be able to have kind of surgical precision without the invasiveness of surgery is really great, and so we were able to isolate what regions of the brain were responsible for some of the faults in his function. We were able to slowly train it up and also increase more of his overall processing speed. And so that not only helped him, already improve symptoms on his own. We did something called HEG training, which uses an infrared sensor to the frontal lobe to actually start increasing blood flow back into the brain, and so that increases a lot of the neuron capacity and more of the just metabolic capacity of the brain, because as a lot of times all the other therapies become secondary to the ability of the brain to metabolically activate. So if you've got a concussion and somebody has really low metabolic capacity, you don't want to start doing rehab with them, because the second you start challenging that, they start to kind of fry.
Right. It overstresses their body. It's too much for them.
It's too much, and so you'll start seeing them where all of a sudden they just, they become more symptomatic with training, right? So that also helps us be able to kind of use not just subjective, but, objective measures of like, how is your metabolic capacity? What's happening here? And then there's other things like the Buffalo treadmill tests and others that came out of New York, and a lot of the research they did out that way. You can look at heart rates, and that's another kind of indirect way to measure metabolic capacity for the brain. But it's like order of operations, like first things first, if there has to be metabolic capacity, so otherwise, yeah.
It makes sense.
Yeah, totally.
because this thing controls everything.
Yeah, totally. Yeah.
So we were talking about concussions, but its ramifications go everywhere. We've talked about sleep, ADHD, even executive functioning. Like, can you talk a little bit more about that? Because we've had, you gave me a good story about ADHD, and then how that, do you mind sharing that one?
Which one? I can't remember now.
About your
mine. Yeah, totally.
History.
Okay, yeah. So it's okay. So quick story is about 3 years ago now it's close to 4 years ago. I hit a point in my career where thankfully I had a thriving practice. I had already seen well over 1,000 patients. I only deal with complex cases, and so, but I really felt like we had a handle on who were able to help and do it well. I was on 2 boards. I had co-founded the interprofessional community. I'm married. I have 3 kids. But what I realized was that I was doing everything kind of poorly. Not poorly, but poorly from my standards, right? And one of the biggest challenges I had was, I wanted to do more things. I wanted to do everything better. But one of the biggest things that I realized was that, man, like, I'm a champ at like making connections, right? I can make connections all day long. But when I need to sit down and do some kind of what's called serial processing, one thing, A and then B and then C and then D, kind of like what you have as a superpower is something that I've been missing. I couldn't just sit in a room and just work at one task for like 3 hours. No way. I would be butterflying back and forth a million times. So that was exhausting. And so that's actually what led me to the brain mapping and the neurofeedback was for myself, because I decided that I was going to double down for my career, for my family, for everything I wanted to do to make the world a better place. I was going to double down on my brain and train my own brain to increase its capacity. I needed a better operating system. Right. So lo and behold, I got a map from another colleague, and I thought, I'd have a couple things, but I mean, here I am. I mean, I'm, Dr. Licata. I've been doing all these things, I'm just really feeling full of myself. And it turns out that, all the skateboarding when I was young, all the snowboarding, all of the football, all of the basketball, all the things that I'd gone through left a bunch of stuff, concussions and other kind of predispositions that I had that really left me with a significant amount of ADHD. Like I didn't even know I had it. I just learned how to manage it. Right. So long story short, I ended up investing in all this work and started having my family do it as well. But for me, I mean, after about, we typically recommend about 30 to 40 sessions to get not only a safe kind of on-ramping to your brain, but a target and then kind of a reinforcement so you keep it. But after about 20 sessions, I was shocked. Like I would sit down and I would have a list of things to do and I would just knock them out. By one. Like that was unheard of. I'd never done it before. And this is the funniest thing. If you would have asked me if it was a problem, I would have told you no. Right? But once I started feeling the capacity increase, now for me to go back to that is just no way. I don't want to, right? Because I mean, my level of efficiency and effectiveness is so much higher, and I was already a pretty high functioning person, So, oh yeah, I mean, it was night and day. It was night and day. And so my wife is thankful now. If I have to do taxes, I stick with it. I finish things through. I get everything to the accountant. It's great. It's great.
Yeah. With that being said, like how many people out there don't even realize that they're not functioning at an optimal level? And then layer that on top of we're in 2 months into the COVID-19 pandemic.
Yeah.
Kids are at home and they're learning from their parents, hopefully, and it's, first of all, it's like my kid's 3 and that's hard enough. Like I can't even imagine if you're in first, second, third grade school, junior high, like trying to teach them that stuff. Like I don't remember that stuff.
Right.
So like, where do you see stuff like brain training helping families and kids that are kind of not, they say they are doing stuff, but I don't know.
Yeah, no, totally. You seldomly know how organized and efficient your brain is until you remove structure. Right. So if you have a structure, like you have to get up, you have to go to school, you have first period, you have second period, you have somebody on you, like already with structure, we know that like things like ADHD and attention deficits and different focus issues are rampant, astronomical. Now, sometimes, I mean, we can go into it and kind of, I think that there's a systemic problem with all of that. However, now COVID, right? Now shelter at home, and you have to now ask a teenager or a 12-year-old to sit in front of a computer for like 8 hours a day and pay attention. Oh, you're going to start to see all kinds of things show up, right? So, and so what's interesting with that is that already we were working with different educators and different tutors and parents working with kids with ADHD already. And so, but the big thing is this, there were fewer parents, and these were usually the desperate ones, the ones that you would consider kind of their kids were on the bottom of the rung in class and in school, and they were so desperate they were willing to kind of go outside the norm and start working on ways to optimize the kid's brain. Now, we would see them. Now what we're seeing are a lot more parents who are saying, look, we need to spend almost as much energy and money on helping our kids' ability to think, as well as giving them all the content on what to think, right?
Right.
So the ability to learn as much as what to learn, right? And oftentimes we don't think about that, if you want to be good at soccer and you never work out, right? You never go through drills. You just play games 24/7, right? Like you would think that's absurd. Don't you feed your players better, right? Don't they do so, right? Like you're helping to optimize their operating system and their hardware, and then they're able to actually perform better, right? But with kids and even professionals, we just settle for our same hardware and our same operating system, and yet we keep thinking we want to get higher and higher results.
Right.
So what we can do is help them optimize.
You make me, well, now there's no standardized testing for however many years, but like when like all of the high school like aged people that I've treated, like I compare their stress level to when I was in high school, it's like tenfold, right? Because like the stresses of getting high test scores and how competitive is it getting to college. And you bring up a good point, like, okay, I'm gonna send my kid to all these SAT classes. Right. I'm just feeding them information.
Yeah.
But are we doing them a disservice because we're overloading their brain because we didn't increase their ability to do so?
Right.
That's what I'm thinking of when you're telling me this.
Exactly. Yeah. I mean, going back to the laptop or the computer model, I mean, try not to get a new laptop, but keep updating the latest operating system. Keep updating all the latest software, right? What's going to happen is the demand on the hardware gets bigger and bigger and bigger. And all of a sudden, your little dinky laptop, mine at least, that I've had for like 3 years, it can't hang anymore. There's not enough RAM. There's not enough memory. Like, there's not enough storage. There's not enough, it just, the hardware can't keep up. Right. And so we're trying to, with the kids that are dealing with the same operating system, we're not touching that. We're not helping them one bit, but we're loading and loading and loading and loading them. It's just, of course, it's going to tilt. So our job and what we're doing now with, mostly they're professionals, and then the professionals bring their kids in. But they get it. They say, look, even if I spend 10% of my income and my energy on my operating system and my hardware, right, then my capacity to handle all the excess, demands on it is only going to go up, right? And so we see many ADHD cases, and cases that wouldn't even be diagnosed as ADHD, but they're just people that know that their productivity is limited, their focus is limited, they procrastinate, they get anxiety, and so they don't do it until the last minute. They spend a whole week, trying to kind of work around those 3 projects. And if they just would have done those 3 projects, it would have been a huge breakthrough in their company or their business. And then students that can't focus. We can see regions and we can see pathways that are related to different forms of attention, and we can help train it.
Can you give me an example of like a student that like, how do they even know that you're there to help them? Like, how do they even, like, without breaking HIPAA, obviously, like, can you give me an example of someone that
so for the most part, this is just, again, our practice. Our practice has been 90% referrals from either other patients or other doctors and health professionals, right? So how do they hear about us? It's usually from one of the two, right? Because we really don't do much marketing at all. We want to start because we now have the capacity to do things like remote training, which is what we'll talk about hopefully next. But so it's usually someone who knows me or knows Vital, head and spine. And so we have, like, the other day we had a functional medicine doctor, right? She's an MD, And she's been trying to deal with this with a student's issues, and the student has all kinds of issues, and the mom doesn't want to put the child on medication, right?
Right.
And so the child has obvious attention issues, and some emotional dysregulation, meaning it's just there's some other stuff happening. And so the functional medicine doctor said, look, let's look at the panels. Let's see what deficiencies and vitamins and minerals and things that this child has, and we'll take care of that part, right? But it looks like there's a little bit of a wiring thing that's going on here. And so they referred them to us, and we did the map, and we saw, very, very classic patterning of what would be considered ADHD. One classic one, and they don't all look the same, but one is there's different wavelengths, and there's one that's called theta, which is kind of a slower wave. It's kind of like when we're really dreamy, or we're really, we always know someone or we're that person, but we're always just kind of imagining things, and we're always ideating things, and we're always remembering things. But usually it's very hard to kind of just get stuff done, right?
Right.
Beta in that same region, in that same area, is the kind of get stuff done, right? And so there's what we call a theta beta ratio. When there's too much theta in that region compared to the betas, there's been literally in the dozens of peer-reviewed studies showing that relationship, that ratio disruption is almost always shows up with what we would consider ADHD, attention deficits. So this child, came in, we measured and had that, right? Wow. And so the mom was just grateful that, again, she didn't have to go on medication. Now, we're not there to tell them to take or not take medication. That's outside of our scope. But we don't even go with the diagnosis. We just say, look, let's just break this down into core resources, right? Your child's ability to hold attention is reduced. Your child's ability to resist impulses is reduced. And we can even see it, we can even break that down and say, auditory processing versus visual processing, we can compare the two, and then we can see the regions that match. So we did that. And then the child comes in and hangs out and plays these video games. I mean, it's kind of cool, right? Yeah. And then usually after about 2 to 4 weeks, the parents will already begin to notice the changes.
Awesome.
Right. And so it's cool. So it's fun. So that's one example, right? But again, they came from a referral.
Right. And I think it's important to, you're one of the smartest dudes that I know, and obviously anyone listening is like, dude, this dude's a geek.
At least the dork factor of yes.
Yes, this dude geeks out.
I'll take that.
But at the same time, you make it very functional for them. It's like you're focusing on just getting better. And then it's like the same thing with at our office. Someone comes with knee pain and someone is so focused on, oh, my doctor said patellofemoral pain, blah, blah, blah. I'm like, I get it. Your medical diagnosis is that, but we're going to function on what you can and what you cannot do. And we're going to get you to a place. And that's what we focus on. Yeah. Because I don't want you to focus on the medical mumbo jumbo. I want you to focus on getting better. Right. And I think that is exactly what you guys do. So during this whole COVID-19, or even if someone wants to get a hold of you and they're not in the Pasadena area, how do you even do the remote training?
Yeah, that's where what's great about remote training is that what we currently do is we have people fly in to get a map, right? Because probably the majority of what we would consider brain mapping or neurofeedback, and this is what we're doing is what we'd consider the next generation of neurofeedback. But a lot of places, the majority don't ever use a map to begin with. Now, that could be a whole other discussion. But what we find is that I would not really touch a person without having a map to understand what their brain is doing, and then train accordingly. And so they'll usually fly in, or depending on their budget, we send someone to fly out and get the map and then come back. Once they have that, and we set up other baseline with an IVA test and a neurocognitive test, and they can do all that remotely. Then literally we use a third-party system where they can hook up it looks like a little band that goes across their forehead. And then it has a little extra electrode, and they just put it on, put it there, and then they use their phone or their iPad, and we can literally remotely, real time, input exactly what we need to do based on their brain. And then they basically play a video game with their mind for about 15 minutes a day, for about 5 days a week, for about 12 weeks.
That's crazy.
And so they're doing that. We can measure everything. We do little Zoom calls with them weekly just to check in and see how they're doing. And everything else after that initial map is they never have to come back in the office again, right?
Wow.
So that's great. And so they'll go to our website, vitalheadandspine.com, and they'll sign up for that. Now, if they can't do the map right now, that becomes a challenge, right? And so we tell people that, maybe when COVID's over, fly over. Sometimes we'll refer them out to some trusted practitioners out in their area.
Mm-hmm.
But we just had literally a family of 3 come from San Diego. We have someone else who will be coming in again from another place in the UK in a few weeks. And that's just usually the norm for people that are outside.
It's pretty cool. If I go to Orlando for 2 months, I might have to come in before I go.
Right. You're going to have time on your hands, right?
I know. So, I can work on myself for 2 months. So,
who couldn't use an upgrade, right? Who can use,
right.
In a way, and this is, I don't know, we can geek into this or not, but, in a way that still honors the human being, right? Because we can, you can take any technology and take it so far that it kind of becomes more about the technology than the human, right? And so everything that we do, and I think we share this, is that we really want to be kind of human-centric, empowering, and we want it to kind of work around them. We don't want it to start kind of morphing who they are and how they think and kind of lose that sense of agency. But yeah, as preserving your own agency and then being able to just kind of say, look, I want to work on my focus for the next 8 weeks and just kind of dial that in is profound. And then you want to say, gosh, you know what? Sometimes I get a tendency towards a little bit of anxiety, and that anxiety response, well, we can see that too. And we can help you train that down so that all of a sudden it feels like there's a little bit of margin, there's a little bit of space between what the event is and your reaction to it,
Right.
And so, yeah.
Really, really cool. I know you're stuck on time, but a little bit, I want to get to know you a little bit better. I want our clientele to get to know you. So if Dr. Licata could look back in time and talk to your 18-year-old self,
oh boy,
what would you tell him?
That's a great question. I don't know, Jason. I don't know. Look, I think one thing that comes to mind is a lot of the things I only know now because of experience, and the experience wasn't a lesson. The experience is what changed me, right? And so I'm a different person because of the experience. And so that would be tough. But I would say this. I would say I think I would trust God. I would trust the process. I would trust the universe a little bit more. I would be a little bit more present in the day-to-day part of it. I think maybe you're similar. I think a lot of us that are very goal-oriented, results focused, our eye is so far towards the prize that sometimes we kind of lose track of the journey and of the road. And I think that I have 3 young kids. You've got 2 younger kids.
Right.
To be able to not even necessarily change what I do, but just to change how I do it.
Right.
And kind of just enjoy more of it. I think I would have told myself to do that a little bit more.
Yeah, mine's along the same lines. When I had this question to ask you, I had thought of my answer, and mine would probably be similar, and it would be to be patient, because it's like you want things so bad that it's not bad to go for goals, but you start to forget about the things that matter, because you're so stuck on this one thing. And I think a big part of this, you always have to look at the positive. Like COVID-19 didn't happen to us, it happened for us.
Mm.
So I get to spend more time with my family, and
Mhm.
me and you, we're busy people.
Right.
And I've never had this much time at home,
Mm.
albeit I'm still busy, but I'm like, okay, because this will hopefully never happen again in our lifetime.
Hopefully, right.
Like, let's enjoy these moments with
Yeah.
our family as much as possible. And like my son's 5 months now, and my daughter just turned 3, and like I've seen them grow every day versus like noticing something. I'm like, oh, that's different. Oh, that's different. I'm like, no, I'm watching it real time, which is really, really cool.
Right. Yeah, no, it's special. And especially when you have these two overlapping seasons. You have parenthood, and then you have kind of building, you're kind of in building stage, building phase of a profession. Um, you know, they both require just a disproportionate amount of attention and energy.
Right.
And when they seem to overlap at the same time, it's almost like something has to give, right? And oftentimes it is the family, it is the relationship. So for you to be able to have that is really special. I think that's wonderful.
Yeah, I've really had to work on myself to, you know, to focus on, like you said, just like focus on the things at hand, and it's my family, it's my family. So like, do you have any advice for people that are struggling at home right now? You know, like on how to de-stress a little bit and just
Yeah.
focus on the positive things, like what kinds of
Yeah.
things?
Yeah, I mean, you know, so they're very practical and very neuroscience-based tips. I think one of them, believe it or not, is actually go outside, right? Like go outside. A colleague of mine, Andrew Huberman, he's a PhD out of Stanford. He posts very often on Instagram, so you can look him up. But his specialty is in understanding the vision centers of the brain and how they influence stress. So this is the big takeaway. When I focus my eyes on a point, like the computer all day long, or on my phone, right? That's very small. That actually triggers a sympathetic response. It activates my stress response, right? But think about going and standing in front of and standing outside, watching a sunset at the beach. Who gets stressed?
Right.
Watching a sunset at the beach. No one that I've ever known will. And part of it is, you know, one's the beauty, two, it's actually the rays of the oranges and reds. But one of the biggest things is what we call panoramic vision. That panoramic vision, that open gaze, actually then stimulates and triggers the other part of our nervous system, our rest and recovery phase, right? The parasympathetics. And so the interesting thing is that the more that we are looking at our phones and looking at our Zoom calls all day long, and we're not outside, and we're not just allowing kind of just looking at the trees, looking at the sunlight, looking at the big wide views, we're ramping that stress response, right? So that's one.
Didn't he use an example? I think it was him about how cows on the pasture, how they view things. Mm-hmm. See, I remember this one from that lecture.
Right, exactly, yeah.
Can you explain that a little bit?
Well, I hope I can. I'm not sure if I exactly can. So they relate it back to actually two different kind of supposedly evolutionary pathways of vision. We actually have two that overlap. And so the oversimplification, because I won't get it exactly right, but the oversimplification is that the animal, the hunting animal, let's say the cheetah, now, you know, locks in and it gets into a stressed response, right? But the grazing animal, the cow, is just wide open, right? It's using wide vision because it also wants to kind of keep everything nice and, you know, wants to know what's in its surroundings, right? And so we have the ability to access both, right? And so, but the problem is that when we're in hunter every day, looking at our Zoom, looking at our phone, flipping through Instagram, you know, trying to shop on Amazon, all those things, we're really kind of just activating a sympathetic response, right?
Got it.
So that's one. If you want, I'll give you one more.
Yeah.
And,
let's do it.
Okay, so the second one, believe it or not, is actually wearing masks increases the sympathetic response. wearing a mask will increase your stress.
Interesting.
Also from another gentleman named Brian McKenzie, who's done significant amount of training with Navy SEALs and elite athletes. He really has taken the neuroscience of carbon dioxide and oxygen.
Okay.
And what happens is that when we're wearing that mask, we're actually recycling carbon dioxide in our breath. And that carbon dioxide, many people call the stress molecule. Because the more carbon dioxide that builds up, we start to get a little bit of that panic, that kind of that sympathetic panic. And so people aren't realizing it, but they're walking in, they're going shopping, and they're sitting in their in a cubicle still, or they're, whatever it is, or they have grandma in the other room, and they're wearing that 24/7. You'll notice, you'll see people take off and go, oh. Right?
That's what I do.
Oh, thank God, it's off, right? Well, part of it is because they've been building CO2, building CO2, building CO2. And for many of us, we're not CO2 tolerant, right? And so, which means we haven't built our physiology to adapt to higher levels of CO2. Athletes, that's a great thing for training, is to build their CO2 tolerance. But, we're talking about the general population, and probably a general population that is probably less healthy, right? I think the US is like number 12 on the top 13 industrialized nations, right? So we're not healthy. So now you wear a mask and you give it to a population who aren't CO2 tolerant. All of a sudden that stress just starts coming up.
Right.
And we start then projecting that to, oh, well, it's because of X or Y or my spouse or my kids. But really, I'm just I'm shifting my physiology, and I have no interpretation and no access on how to change it.
Right.
So take it off if you can when it's safe, right?
Yeah.
And then there are ways to actually train up your CO2 tolerance.
Wow, that's interesting, because when we're at the office and we're treating clients back to back to back, and then I just gonna go to going to my office real quick. I'm like, oh my goodness, which would normally I could breeze through it.
Right.
But now every 2 clients or so, we have to let me sip of water. Let me recalibrate,
Right. And I did a simple study, because we do blood oxygen saturation. So again, 100% blood oxygen is good. If you get down below a certain number, I just did a simple thing. We have a clinical grade blood oxygen saturation machine. And I just sat down at my desk and I looked at it, and I was at 99% blood oxygen. And I just put the mask on and breathed for about 5 minutes, and I checked it, and it went down to 96.
Wow.
Right. And so, now again, I didn't get up and do anything. I was just sitting, and it already dropped it down by, 3-4%. So, but now all of a sudden we start doing it. And the more we're breathing, the more we're activating that. And ironically enough, what happens is we then start mouth breathing a lot more, because we're trying to get more in, and that actually becomes another trigger. These are all physiological triggers, right?
Interesting.
And so that's, that's a very, neuroscience-based hack. You can tweak right away, and you can do something about it, All
right. Awesome, man. So
cool, man. This has been fun.
This is amazing. And again, how do people get a hold of what's your website again?
Yeah, so vitalheadandspine.com is our website. You can check it out. We also have, it may or may not be, you can email us at training@vitalheadandspine.com. And we also send out a weekly 3 to Thrive email every Monday with basically brain-based hacks, brain-based things to kind of help you get a head start on the week. And so if people want to at least sign up for that and get some info, it's, we don't give any fluff. It'll all be good stuff for you.
Yeah.
So
I get them every week, so they're awesome. And
good. Okay. You like them. See, there you go.
See, it's to the point. You're like, okay, let me try this. So,
right. Good.
Dr. Licata, I really appreciate you being on
Thank you, Jason.
this Zoom interview. And again, everyone that's interested, check out their website, check out all the amazing stuff that they do. So
thanks, man. And I love what you guys are doing. We'll stay connected.
All right. Appreciate you.
All right. You too.